This lecture will be on the bones of the upper limb. We're going to look at the appendicular skeleton of the upper limb. And we're going to start with just a list of the bones. The bones of the upper limb include the clavicle, scapula, the humerus, the radius, the ulna. And then in the hand, you have the carpals, the metacarpals, and I said the hand, the fingers, the phalanges of the hand. So we're going to start with the clavicle. This photograph is of a superior view of a left clavicle. We have two joints that are formed by the clavicle, the sternoclavicular with the sternal end, which is rounded. It is the only axial to appendicular joint for the upper limb to the axial skeleton. And at the other end, the acromial end, we have the AC joint, also known as the acromioclavicular joint with the scapula. It is both of these are synovial planar joints. It is called the acromial end because it meets the acromion of the scapula, which we'll see in a moment. If I turn over the clavicle and I look on the inferior, the sternal end is still rounded, the acromial end is flat. You'll notice that the largest curvature is going towards the sternal end. But the real reason I turn the bone to the inferior view is so you could see this, which I'm circling now in red, is the conoid tubercle. This is a named landmark, and it's very important for being able to tell right from left clavicle. So what are the rules for telling right and left clavicle? The sternal end is medial. The anterior, it is anteriorly convex for the first 2/3 of the bone on both sides. And then the conoid tubercle is posterior inferior. So it's actually pointing inferiorly, but it's on the posterior side, so you can barely see it right there with the circle. And so this is a photograph of both a right and a left clavicle. You'll be able to play with those bones in the lab. For the scapula, scapula has a lot of landmarks. It also forms two joints. It forms the same AC joint, and then it forms the shoulder joint with the humerus. The shoulder joint is a synovial ball and socket joint. Its formal name is the glenohumeral joint, but please feel free to just call it the shoulder. Remember that the scapula does not connect to the axial skeleton at all. Here is a set of landmarks for the scapula. We have the coracoid process, which does stick out. We'll see a better view of this in just a moment, but it comes off the bone. The glenoid fossa, which is where we make the shoulder joint. Just inferior to the glenoid fossa, we have something called the infra, meaning inferior, infraglenoid tubercle, which is a little triangular shaped bump. The inferior angle is on the inferior edge. Largest here is this subscapular fossa, which we will see is for the muscle subscapularis, and being able to tell medial and lateral edges from there. And then we have the superior angle at the top. If I look at it posteriorly, you still have the superior angle as a landmark, but in this space between the superior angle and the spine, you have the supraspinous fossa. And of course, the spine itself is in between, and then inferior, you've got the infraspinous fossa. Each of these fossas has muscles named for it. And then the acromion is the piece here that actually sticks out beyond. So the acromial end of the scapula is named for the acromion of the scapula. I also did a superior view as if you were looking straight down, mostly so that you could better see this coracoid process, how it angles anteriorly, and you get a better view of this supraspinous fossa. Note the small hole in the supraspinous fossa. That is because the bone is thin and somebody tapped at it with either a pen or a pencil and cracked the bone. The other thing you can see because of this view is at the very top of the glenoid fossa, you have the supraglenoid tubercle. The two glenoid tubercles, supra and infra, are very important because they are for muscle attachments. But this gives you the orientation of that bone. How do you tell a right from a left scapula? Now, these we're looking as if we are looking at somebody's back. So this is the posterior view. So when you look at it, the spine itself is posterior, or you could use the acromion. The superior angle is, well, superior, or you could say the inferior angle is inferior. And then the glenoid fossa is lateral so that we can make the shoulder joints laterally. The scapula is one of the easier bones to tell right from left, but it's still a potential exam question, so it's good to know. The humerus. The humerus is the bone of the arm. And here I put on, with the full bone, two very important landmarks that are pretty much only seen on the full bone. We do have the shoulder joint again, which I reiterated is a ball and socket, and the elbow joint with both the ulna and the radius is a synovial hinge joint. But I circled the surgical neck. The humerus does have what's considered the anatomical neck, but the surgical neck is more important, largely because this is where the bone frequently breaks if somebody falls. And I highlighted the deltoid tuberosity, which is this entire elongated rough spot right there. Your lab book notates a radial groove. We're not doing the radial groove. Radial groove is not an answer on your test. However, deltoid tuberosity is large and is very important because it's the attachment point of the deltoid. So you need that in the mid bone. But I decided to take a close-up look at the proximal end. So at the proximal end, you have the head, which is this very smooth piece, would be covered with articular cartilage in real life, but the head makes the shoulder joint. You have the greater tubercle, which is this entire edge, lateral edge, which is where you have a lot of bones, or a lot of muscles attached to this bone. The lesser tubercle is much smaller. It's right center, and it is anterior only. The greater tubercle you can see from the posterior, but what's really important here is this groove that goes between the two tubercles. The fancy name is the intertubercular sulcus, but a lot of people have a hard time with that. So you may also call it the bicipital groove. That is because the long head of biceps brachii goes through there. So bicipital biceps. So that's why it's called the bicipital groove at the proximal end. The distal end also has a lot going on. Remember, this is where we make the elbow joint. Let's start with the trochlea, which is this landmark. It's a bow tie shaped piece. The name trochlea means pulley, and it kind of looks like a little pulley there. That is for the ulna to attach for the elbow joint. And we have this very round, piece called the capitulum. A lot of people have trouble with pronouncing that. It is a capitulum. Think the word capitulate, meaning you will give in. You will capitulate and you will say capitulum. It is for the head of the radius. Superior to the capitulum, we have the radial fossa for the head of the radius. And superior to the trochlea, we have the coronoid fossa, which is for the coronoid process on the ulna. Medially, we have this great big medial epicondyl, which means a large extension on the medial side. The medial epicondyle is for the attachment of all your common flexor muscles in the forearm. The lateral epicondyle is much smaller because the muscles of extension are much smaller. And we have this, what we call the lateral supracondylar ridge, which is the important attachment for brachioradialis. So those are the landmarks of the anterior distal end. And then we get to the posterior. And the key here is I re-tagged the medial epicondyle because it is your landmark, and you can see the posterior portion of the trochlea. But the key to this is that opening there, which is called the olecranon fossa. The olecranon of the elbow, which is the point of your elbow that you can feel, is called the olecranon, and it has to fit into that fossa every time you fully extend the elbow so that your arm can be straight. How do you tell right from left humerus? Here's photos. Obviously, these are not from the same person. They're not matched. But to tell right from left humerus, the head is proximal. The head is also medial. You can use the same landmark for two things. And then for anterior versus posterior, you can use the lesser tubercle is anterior. Or if you look at the posterior side, you would see the olecranon fossa. So right from left humerus.